Well, thanks for staying with us here on Sunrise. This morning, our topic of discussion is new immunotherapies for cancer, which are aimed at stimulating and boosting the body's own immune response to destroy cancer cells. It is said that they represent the most promising new cancer treatment approach since the development of the first chemotherapies in the late 1940s. Many scientists and doctors around the world are studying new ways to use immunotherapy to treat cancer. To talk more about this, we are joined by medical oncologist and director of the Santon Oncology Center, Dr. Daniel Vorobiof. Today's question is, are we winning the fight against cancer? You at home can ask the doctor a question on 011-447-1742. That's 011-447-1742 or 2570. Doctor, thank you so much for joining us this morning.
Thank you for the invitation.
Now, let us start. How different is the new immunotherapies compared to your chemotherapy and radiotherapy?
Well, it's a completely different thing because chemotherapy, surgery for cancer, radiation, we treat the cancer where it is, we try to remove it, we try to poison the cells, while immunotherapy is trying our own immune system to go and become stronger and fight the cancer cells. Cancer cells are very clever cells, and they have been always like that. And so they try to evade the immune system. They try to go around it in order to grow and to kill. Okay. And that's what they do. Cancer cells or immune cells need to fight that. They need to close that gap. And therefore, cancer sometimes wins and blocks the cells, the immune cells, and those cells then cannot do their job. Oh. Immunotherapies, they are there to unblock that inhibition and allow the immune cells to go and fight the cancer again.
Okay, so would you say that this is a cutting-edge area of research, and is this the new way of treating cancer? Is this going to change the game completely?
I think it's going to, but it's not yet doing it. I think it's going to take some time. 10 years ago, when the new developments happened in immune system, and that we understood more about it, these new pathways, we thought that was a very nice theory, and we didn't really realize that it will be at this stage as it is already happening. Not every cancer responds, and not every patient responds to the treatment. So we need to be very careful because we need to select the patients very well. Unfortunately, there are some cancers that not yet we have found the trick there.
Okay, so when you look at our immune system naturally without immunotherapy, shouldn't we already be fighting cancer?
Sure.
And
sure.
How does that work?
Sure. So the T cells, which are the main cells in the immune system, they recognize the cancer cells or abnormal cells, viruses, and things like this, and they go and kill those cells. But sometimes there are blockages to that. And those blockages are because proteins, what we call antigens, that the cancer cells have, that they go and block the T cell. When that happens, the T cell is inactive and cannot do the job.
Okay. Now, obviously, can immunotherapy prevent cancer? That's the ultimate question now.
Prevent cancer. That's prevent is in medicine. It's a very strong word. And let me tell you that first we need to understand more about the mechanism of the immune system and how well immunotherapy works. At the moment, we know of many mechanisms, many pathways by which the cancer cell can block the T cells. But there are only two pathways which we are working on. And so there are many more, and that's going to be the new wave, the new future. To say that now we can use that to prevent, probably, but it's going to take us a long way to determine that.
So immunotherapy, it's a new craze, it's new now, but I'm sure this has been developed over a long time.
You're right. This has been going for many, many years, but we couldn't find the right way that cancer cells were tricking the immune system. And that was found around 12 or 15 years ago.
Okay.
And then new drugs were developed to fight that. So now we have approximately 5 new drugs, which we are starting to use.
This literally sounds like a game between the immune system and the cancer cells. So it's really interesting. Now, can you combine immunotherapy with treatments such as chemotherapy and radiotherapy?
Sure. So let me first say about the game. It is a game because it's like the old Pac-Man.
Yeah,
and
of
so
course,
that you want to try. Yeah, that's exactly. So it is a game. And the other thing, it is a game, and you will understand and from your IT generation that what is happening is that the cancer cell is creating a firewall and doesn't allow the immune system cells to actually become active. And what we are trying with the new drugs is to break that firewall. So we are now being on the other side and trying to do that. Now, to combine with chemotherapy, it's possible. There are ongoing clinical trials at the moment. Combined with radiation, it will be possible too. If not together, but one after the other one, sequentially, yes, it's possible. So it's not a specialty on its own without the interference of the others or without the help of the others. No, it's a multi-therapeutic approach.
So definitely they seem they'll be working together in curing, basically, or fighting cancer.
Sure.
Doctor, we say thank you so much for your time. I definitely have learned a lot in this from this segment.
Thank you.
That was medical oncologist Dr. Daniel Vorobiof talking to us about new immunotherapies that are aimed at stimulating and boosting the body's own immune response to destroy cancer cells. For more information, you can go to www.who.org or www.cancer.org to find out more information.